My name is Raniam. I'm the co-founder and CEO of Novasight. Happy to be here and thank you for inviting me. And my topic today would be digital treatment in ophthalmology. Why doesn't it move? Okay. So what is digital therapeutics? Digital therapeutics, or DTX, is a software that delivers evidence-based therapeutics interventions to prevent or treat a disorder or a disease. And we know there are specific stages in therapeutics. The first one is to prevent, and then to manage, and if possible, also to treat. When thinking about therapeutics or digital health in ophthalmology, we're used to think about diagnostics like retinal image analysis through AI, telehealth, and improvement of health systems IT. But there's a new and exciting, rapidly growing segment of digital health, which is digital therapeutics in ophthalmology. So in ophthalmology, therapeutics is usually done to the brain, where the eyes are mainly the channels to deliver these therapeutics. So a few areas that is connected with their digital therapeutics in ophthalmology are amblyopia treatment, lazy eye treatment, myopia control, convergence insufficiency training, and nystagmus treatment. And as you can see, most of these areas are connected to children. And there are two reasons for that. It's not by chance. The first one is that the brain is still plastic with children. It's easier to deliver the treatment when the brain is still evolving. The second thing is that the eyes are actually evolving in the first years of childhood and teenage years, and this is mainly connected to myopia. With adults, we know that we can deliver therapeutics in presbyopia treatment and IOL adaptation. This is more usually treated by a way or a method called perceptual learning. Specific stimuli to the brain at the threshold of recognition helps to improve visual acuity. Today in this talk, I will mainly focus on the first two therapeutics. The first one is amblyopia lazy eye treatment, and the second one is myopia control. So I'll start with lazy eye amblyopia. So as you heard today, lazy eye affects about 3% of the population, and this is the leading cause of vision loss in children. And if left untreated, lazy eye would affect almost all aspects of quality of life, such as coordination, reading skills, and even road safety. Now, the gold standard for treating amblyopia, which was the same for maybe the last 200 years, is patching. The doctor would prescribe a patch to be placed over the strong eye in order to force the brain to work with the weak eye. But we know the kids hate the patch. Compliance is very low, below 50%. And even if treated correctly, once treatment is stopped, we see about 25% of reoccurrence. And this is an inherently monocular treatment, so each eye is treated at a time. So what are the current emerging digital treatments for lazy eye? So the main concept here is dichoptic treatment, meaning that the two eyes are treated together and not as with a patch, which is only a monocular treatment. So from left to right, the first one is VR treatment, visual reality treatment. In this case, the manufacturers produce pre-prepared content, usually videos, and the image that is delivered to the weak eye, to the strong eye, sorry, the dominant eye, is being degraded to companies in this space. For instance, are Vivid Vision and Luminopia from the US. Next is iPad games. In this case, the manufacturers are preparing, actually creating games that are specifically designed for amblyopia treatment. So the kids are wearing blue-red glasses, and the treatment is done through images in red and blue, where the images that are presented to the dominant eye are degraded. Such companies are Amblyopay and Amblyotech, which was acquired by Novartis about 2 years ago. The third one is our technology. It's based on eye tracking. Here you can see the CureSight from Novasight, and I will now explain a little bit more about that. So I'll start with eye tracking. What is eye tracking? Eye tracking is the is a technology that allows us to track the position and gaze direction of the eyes very, very fast, in our case about 90 times per second, and delivers us a totally objective information. Now we are using this information for several things, for instance, real-time image processing according to the momentary gaze position, or diagnostics based on the analyzing the eye response to different stimuli that we present on screen. Here you can see the CureSight home treatment device. The way that it works is that the kid is getting red-blue glasses and using the device at home to watch his favorite content. Now this content could be anything. So imagine Netflix, Zoom, YouTube in China, different links that the kids love. So whatever that is streamed online could be used for therapeutics. The method behind it are actually two things that are happening in real time. The first one is that we separate the two images to the two eye through real-time color conversion. And then on the strong eye only, on the red channel, as you see here, we blur the center of vision according to the momentary gaze position. So we follow the eyes and always blur the center of vision. Now, this device is not a standalone device. It's connected to the cloud, to the physician, and physician can monitor the compliance of the patients through the eye tracking and also the progression of the treatment. And this treatment is aimed to not only to improve the visual acuity on the amblyoptic eye, but also to create binocular vision and 3D perception. So very recently, about a few months ago, we released the top-line data from our pivotal study that included 103 kids. This is the first ever pivotal study that was showing a non-inferiority to patching. So not only it was a randomized controlled study against patching, and not only that we showed non-inferiority, actually, as you can see on the left-hand side, the results of the treatment were better than patching. There was a 93% adherence to the study, to the prescribed time, and a 95% of satisfaction by the parents. In terms of regulatory, we already have a CE mark for Europe. FDA is expected this month, so we are on the last stretch on the FDA clearance step. And in China, we're currently running a study with 4 sites, 2 in Shanghai, 1 in Beijing, 1 in Tianjin, and we expect to get the NMPA approval for this technology by the end of next year. So now switching to myopia. As you probably know very well, myopia is a major risk factor for major eye complications at a later stage in life. In China, we know that about 85% of teenagers already suffering from myopia today. And we know that it is estimated that by 2050, more than half of the global population would be suffering from myopia. The global annual direct cost of treating myopia is about 870 billion by 2050. Now, the main causes for this surge, this amazing surge of myopia over the 21st century, as you can see on the left-hand side, is the change in the way of life. The modern way of life includes screen time and lack of outdoor activities. So in order to treat myopia digitally, until now, we know of 2 companies that are trying to do that. First one is called Dopa Vision from Europe, and they are using specific stimuli of light to the eyes in order to enhance dopamine creation in the retina, and this way to slow down the progression of the eye. Well, us, the Novocyte, we came up with a different technology which runs on every screen, again, using eye tracking in order to slow down myopia. So how does it work? Let's start with what we have today on the market. So there are a few optical solutions. Of course, there are drug solutions like atropine, but on the optical front, we have a few solutions to slow down myopia. First one is by contact lenses, so either ortho-K specific contact lenses or other specialized contact lenses. And they use this principle, which is called peripheral myopic blur, for creating a blur, a myopic blur on the periphery of the retina. Then we have glasses that are actually doing the same. In this case, there are refractive elements on the periphery of the lens that are refracting differently the ray of light, and again, creating the peripheral myopic blur on the periphery of the retina. Now, very recently, a new technology called DOT was not using refractive elements, but actually light scattering diffusive elements on the periphery of the lens. And in this case, not creating a myopic blur, but just reducing contrast on the periphery of the retina. And they proved that it is working. There are now 2 years, two-year study results showing that actually this technology that is only scattering the light, reducing the contrast on the periphery, actually slows down myopia. But what are the main disadvantages in the glasses solution? So first of all, the big advantage, it's easy to prescribe. So it's much easier than prescribing contact lenses or drugs. So we do think that glasses are going to take a large portion of the market in the coming years. But there are two inherent disadvantages by using glasses. The first one is that in order to accommodate the eye movements, then there's a relatively large area that is kept clear with no therapeutic effect. And this is limiting the therapeutic effect, actually, because it's quite large. And when the kid is looking away, moving his eyes more than the central vision area, which is around 9 millimeters, he would start to see a degraded vision. The second problem with this solution is that it's easy to remove. So when the kid is looking and using screens at a relatively short distance, which is the most important time of the day to treat, then many kids would just remove the glasses because they see better. They're myopic and there's no problem to see near objects, so they don't really need the glasses, and in many cases they just remove. In order to solve these issues, we came up with a trackside solution. So what we are actually doing is similar to what is done with the glasses, but this time we're doing that digitally. So we blur the periphery. It's exactly the opposite of what we are doing on lazy eye amblyopia. In amblyopia, we are blurring the central vision. Here, we are blurring the periphery for the two eyes together, so you don't really need to wear any glasses except your prescription glasses. And as you will see now, we'll start by showing you how a kid is looking at a screen which is blurring at real time the periphery. In this case, we enhance the blurring just to be able to see that on the presentation. So easy for you to understand. And here you can see this reticle, these moving circles are simulating the area or that the eye tracker or the tracking of the eyes are. And as you saw a second ago, there were two circles. The green one was the area that we keep clear, and the red one was actually simulating what is needed to be kept clear with glasses, which is much larger. So because of that, we think, but we need to prove, and I will tell you in a minute where we at in the development of this product, we need to prove that it's actually working, but theoretically, because we can keep a smaller area clear, then the therapeutic effect should be better than the one which is delivered by glasses. So I will end by telling you where we're at with this project. So we are now engaged in a POC study, proof of concept study, to measure the fast response of the corridor thickness when we deliver this myopic, peripheral blur. And then following hopefully good initial results, we will start a pilot study, both in Israel and in Singapore, to measure the axial length change and refraction change in 1-year study with a 6 months readout. And then in parallel, we will start a pivotal study, 3-year study, that will be also used for regulation. There's here, I would say, an opportunity to use this as a wellness application even before we get regulation approval. With this, I end up my presentation. Thank you very much for this opportunity and happy to answer any questions.